World first trial in Melbourne is giving hope to premature babies and their parents. The breakthrough study is looking at whether the blood cells from a baby's umbilical cord could reduce their risk of lifelong health issues. Dr. Atul Malhotra from Monash Children's Hospital joins us now. Dr. Malhotra, how does this work?
Thanks, Mike. So we know that the umbilical cord is used for a variety of conditions. It's actually approved for 80 conditions, most of them related to cancer or blood disorders. What we're trying to do in this trial, which is a feasibility study in extremely premature infants, these are infants born less than 28 weeks of gestation, less than 1 kilograms in most cases, is can we actually harvest those cells which might be really beneficial to them?
You kind of touched on it there, I think, but what kind of health issues are you trying to minimise for babies who are born especially prematurely?
So, Mike, when babies are born premature, especially extremely premature, they are at risk of a number of problems. Now, over the years, we have become really good at the health sector. Medical technologies, doctors and nurses have really, kind of excelled in improving survival of these extremely premature infants. But unfortunately, many of them go on to have lung, heart and other problems. So what we hope is that by giving these cells, which are the baby's own cells, concentrated back to them, we will be able to minimize those heart and lung problems.
10 babies have already undergone the procedure. Can you talk us through how they're doing now?
Yeah, so I would like to remind the viewers that this is a feasibility and safety study. So the first arm of the study was to actually work out that we can collect enough blood from these babies so that we can harvest those cells and give it back to them. The next arm would be to check their efficacy. So that will include another cohort of babies where we will give one set of those babies those cells and the other set will not get those cells, and we'll know if it actually improves them. In the 10 or so who have received it so far, we have not seen any untoward complications. Remember, these are all extremely premature infants, so they have complications, but we haven't seen any complications from the cells they've received so far. So far so good. It looks like it's feasible and it looks like it is safe. Next, we need to see, once the study is complete, if it's efficacious.
Okay, incredible work. Dr. Atul Malhotra, thank you very much for your time this afternoon.
Thank you.